Hello, good day CI. My name is Christian Maidandoy from DSN Level 1D, and this is my return demonstration for the ear assessment. Before I entered my patient's room, I already washed my hands, and then I will provide a privacy before we start the assessment. Hello, good day sir. My name is Christian Maidandoy. I'm your student nurse for the day. And today sir, I'm going to assist you with your ear. May I know your name sir? How may I address you sir?
You can call me JD.
Okay, Mr. JD. I'm going to start the inspection with your call, tragus, and your lobial. So first, before I will inspect it, I will first put some alcohol. Mr. JD, I'm going to start the inspection with your call, tragus, and lobial. So, may I ask you, sir, is it okay for you if I touch some parts of your ears? Okay, now I'm going to start to inspect your ears with the size. The size is equal and bilateral. The auricle is aligned to corner of each eyes and is within vertical position. The air lobes are free attached to adjacent skin with no appearance of lobe. The skin is smooth with no liaison lamp or any nobule, and the color of your ears is consistent with your face, and there is no sign of discharge or any drainage and inflammation that is present in your ears, which is very normal. Next is I'm going to inspect your external auditory canal. So is it okay for you sir if I'll touch some part of your ears again? Okay. Assuming that this is an otoscope, I will ask my patient to tilt his head opposite my direction, and I will hold the otoscope in my dominant hand and turn the lights on. I will use my hand to grasp my client's ears or the auricle firmly but gently pull out, up, and back to strengthen the external auditory canal. This position prevents forceful insertion of the otoscope and help to steady hand throughout the examination. As otoscope been inserted in my patient's ear, and I will, as this otoscope inserted in my patient's ear canal, I will carefully not to touch the either side of the portion of the canal wall, because it is covered with a thin, sensitive layer of epithelium, and any pressure might cause a pain in my patient. So, I'm going to start the examination. I will first turn on now I'm going to start the examination, and now I'm going to turn on the light of my improvised otoscope. So, sir, Mr. JD, will you tilt your head opposite in my direction? Okay. And now I'm going to grab his auricle, and I will pull this out and up and back to strengthen the external auditory canal, and then I'm going to insert my otoscope and my improvised otoscope, and there. Okay, and then I will repeat this into the other side. May you tilt your head in my opposite direction. Okay. And then I will use my right hand to push out and up back to strengthen the external auditory of my patient. Okay, you may go back to the position. Tunnel walls of my patient are in normal and it is in color pink and smooth without any nodule, and the airwax is present, which is normal. Next is we're going to inspect the tympanic membrane. In this inspection, we will be using a otoscope with a insufflator. So we will insert this in the ear of our patient and rotate it around to view an image that is like piece melt together to fully assess the tympanic membrane and position it to a slightly anterior to see the tympanic membrane. The tympanic membrane should be in pearly gray, shiny, and translucent, and with no bulging or retraction. We should see that the cone-shaped reflection of the otoscope light at the right ear should be at 5 o'clock and the left ear should be in 7 o'clock. The short process and handle of the Melios and the Ombo are clearly visible, and also to evaluate the mobility of the tympanic membrane, we can perform a pre-pneumatic otoscopy with a bulb insufflator attached by using an otoscope with a bulb insufflator. But we are lack of material, so we can perform it right now. But the healthy tympanic membrane is flustered when the bulbs is inflated and return to its resting position once the air is released. Next is I'm going to perform a whisper test. So may I ask you, sir, to cover your left ear, and then I will say a 2 syllables, and then can you please repeat it after me? I will say a 2 syllables word, and then can you please repeat after me?
Apple.
And okay, very nice. Can you cover the other one? And then okay, very nice testing. And then can you put your hands now down? May I rub? Is it okay for you, sir, if I rub your tracheus? Do you feel any tenderness?
No.
Okay, and I will do it on the other side. Do you feel any tenderness or pain or anything?
No.
Okay, very nice. So next is I will perform a Weber test. This help to evaluate your conduction of sound waves through bone to help distinguish between conductive hearing and sensorial hearing. So I have here an improvised toning fork, and I will place this in the middle of your head or in your forehead, but I will place this in your middle of your forehead. And before that, I will straight this in the behind of my hand. So I will start now. Okay. Do you hear anything? Do you hear the sound in both of your ears?
Yes.
Okay, very nice. I will do it again. Can you cover your other ears? Do you hear the sound? Do you feel the vibration? Okay, then you can put it down now, and then can you cover the other ear, the right one? Can you feel the vibration? Can you hear the sound? Okay, very nice. The vibration are heard equally well in both ears, which is very normal. And so everything is normal, and there is no sign of that he has a hearing loss. Next is I'm going to perform the rain test, which is I'm going to place my improvised toning fork in your mastoid process. I will transfer this into the external auditory canal. And this rain test compares air and bone conduction sound. So I will start now. Is it okay? Okay. Do you hear the sound in your mastoid until in your external canal? Yes? Okay, very nice. You hear the sound from the mastoid into external auditory. Okay, I will do it again, okay? You hear it again? Then we'll do it again. Did you hear it? Okay, very nice. The air conduction sound is normally heard longer than the bone conduction sound, which is determined as normal, and there is no any sign of hearing loss in my patient's external auditory canal. Next is the Romberg test. I will ask my patient to stand and put on his feet together, and then put his hand at the side, and then open eyes, then close. Okay, can you please stand, sir? And can you put on your feet together, and then your hand at the side, and then open eyes, and then can you please close your eyes? I will just count 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, thank you, sir. You can open your eyes now. And then you can go back to your position. Okay, sir, you maintained your position for about 20 seconds, which is very nice and good. Normal. Everything is normal. Your balance is very normal. And that indicates that there is no abnormality. Okay, sir, thank you for cooperating. You may rest now, and thank you for cooperating for today's assessment. So, thank you. So, after the assessment, I will wash my hands and then record